So what is the schedule of a medical resident? In this episode of the TMJ Show, guys, I'm going to walk you step by step through my schedule, hour per hour. Let's get into it. All right, guys, what is going on? Lux here from the MD Journey, helping you succeed on your medical journey with less stress. If you're new to the channel, quick welcome. My name is Lux. I'm an internal medicine resident. I've been making videos, now podcast episodes for individuals just like you to help you succeed on your medical journey with less stress. So if you enjoy the concepts and message of this channel, then definitely encourage you to go ahead and subscribe to us on YouTube or on podcasts, wherever you're listening. But today I want to continue the raw format of the TMJ Show, where basically I am answering the questions that you guys are sending me through email, through YouTube comments, and just putting them in the form of a YouTube video or podcast episode. So again, if you have pressing questions, you feel like I can answer them, then go ahead and drop them in the comment section or send me an email at themdjourney.com@gmail.com. But today we're going to be talking a little bit more selfishly about me and basically what my schedule as a resident looks like. So as we get into my schedule, it really breaks down to two different styles. One is an inpatient schedule and one is going to be an outpatient schedule. Inpatient is kind of like a hospital rotation. For me, since I'm internal medicine, that includes things like ICU, normal general wards where you're just admitting patients with typical diseases, things like pneumonia, heart failure, and then there's things that are more advanced, so cardiology ICU, medical ICU. So those are inpatient rotations. And then outpatient rotations are a good way to think about them as just like clinics. So your general primary care clinics, and then specialty clinics. So if you go see an allergist, that's going to be where I'm going to be working later today. Or if you go see a kidney doctor in their clinic, those are outpatient clinics. So the schedule really varies depending on which one I'm doing. But basically, I'm going to be walking you through first my inpatient schedules, and I'll be walking you through my outpatient schedules. Now, this is going to be similar for a lot of residents, but obviously if you're doing more time-intensive specialties like surgery, your hours are probably going to start earlier and you're unfortunately going to end earlier. That's just how it is. But let's get into inpatient schedule. Now, obviously, this is going to vary from residency to residency and specialty to specialty. So the surgeons that are going to have much worse hours are going to come earlier than I do and likely stay longer. That's just kind of the nature of the beast. And there are going to be other specialties that will have later hours and they're going to be leaving earlier. So let's start with the inpatient rotations. I'm going to walk you through in two phases. One is going to be the morning and the one is going to be the afternoon. Now, the morning is going to start anywhere from 5:30 to 6:30 depending on the day. Sometimes, depending on the rotation, your specific team is in charge of admitting new patients that get presented to the emergency room or are sick or in the hospital that require your care. And for those days, you may have to come in a little bit earlier because you have to take care of the old patients you already had on your list and then be ready to be responsible for new ones. But on other days, while other teams are all on call, you may be able to come in later because then all the patients that you have to worry about are the ones who have already been on your list. So again, 5:30 to 6:30 depending on the day. And now anywhere from 5:30, I would say, to about 8 or 9 is where you get to see your old patients, make sure you look up their vitals, their labs, document everything that's happened to them, come up with a plan, what do you want to change, and then you're going to meet with usually your supervising attending and talk to them about each and every single patient. So if you're a medical student, you know this is called rounds, and this is basically where you get to present the progress overnight, give an H&P and things of that sort. So then from 9 to 12 is typically where you're going to be rounding on all your old patients. The attending who's going to be looking over all the patients is going to give their recommendations on what medications, what treatments, what imaging, etc. needs to be done on each patient. And then basically after that, from 12 to 1, take a lunch break if you have time. And then from 1 to whenever the day ends is going to be the afternoon session, is where you're going to basically be spending a majority of your time basically carrying out all those recommendations that were given to you at the start of the day. That means, getting in touch with specialists. If you have a patient with heart disease and you're not really sure how to manage it, or if you have somebody with an interesting infection, maybe you want to call the infectious disease doctor to help you out. Those are going to be doctors that you get in touch with in the afternoon, get their recommendations, apply them to your patient, and then if you have any sicker patients that you need to monitor that have kind of taken a course for the worst, then you can go ahead and monitor them and make sure they're stabilized before you go home. Now, going home really depends on the rotation in the day again, but typically I would say on a general internal medicine rotation, you would go home around 3, 4, or 5. Again, sometimes you can have lighter days or you may go home a little bit earlier, but I would say that's the average. And then on your call days where you're admitting patients till later, or on a more intensive rotation like ICU, you may not be going home until later, maybe like 7 or 8, because you have to make sure that all the new patients are tucked in, all your histories and physical notes are in. That takes some time. Now let's get into the outpatient schedule, which honestly in terms of hours is much nicer. You usually start a little bit later, usually finish a little bit earlier, and it really just depends on style. on if you choose to do this in the future. This is a good example of where I can easily wake up, have an extra hour to my day, and then still find some time to record a YouTube and TMJ show episode for you guys. But typically an outpatient schedule will start, I would say about 8 to 9 is when clinic starts. You'll go all the way to about 12 or when you're finished seeing your last patient for the morning. And then typically you'll have a lunch break from 12 to 1. You'll come back from 1 to about 5 or 4 and see the rest of your afternoon patients, and then finish writing your notes, and then you're good for the day. So yesterday, for example, I had a full day of clinic, which I came in at about 8 o'clock, saw patients all the way to 12, had a lunch break, and then about 1 to 4:30 is when I saw my evening patients. And then I spent about an extra 30 minutes to finish all my notes, about 5 o'clock. And I spent an extra 10-15 minutes just kind of wrapping up things and looking up patients for future dates. That way I wouldn't have to do it the day before. Now those are basically my inpatient and outpatient schedules. Now a lot of the questions that I get is, how often do you get off in residency? Do you feel like you have enough days off? Now the answer may vary depending on who you ask and what rotation you ask them on. But typically my schedule works out to where I get every 4th to 5th weekend off, like where I have a golden weekend, 2 days in a row protected, where I can make a trip outside, go see family, things of that sort. But typically within every rotation, I have about every 4 to 6 days off. So about 1 day, 1-2 days average on per week off. And it may work out certain rotations where I'm working several days in a row and then finally get a day off and I'm kind of burnt out. But 4 to 6 days I would say is pretty average. And so that gives me enough time to basically get some more sleep, as well as work on other projects I'm interested in. Now a little bit of a personal note, on days that I'm on an outpatient schedule or where I don't have to get in until like 6:30 or 7 or 8 like today, then it gives me a little bit of more leeway to wake up still on my early hours of like 4:30, 5:30 and still get an extra time to do some reading, work on some medical projects, or work on projects for the MD journey like this podcast episode. So that just goes to show you that you can still enjoy your priorities, your hobbies, the things that are important to you, and fit them into a busy residency schedule. You just have to find those open hours, and sometimes it may just be an open hour and fit in your priority, whether that may be working out or spending time with a loved one. It's totally possible. And lastly, we have to talk about sleep. You know, how much sleep do I get? What time do I go to bed? Now, in terms of what time I sleep, I go to bed around 10 or 11. I would say it's pretty average. Sometimes I knock out much quicker after a busy ICU day, for example. And some days I may stay up a little bit later, especially if I have a later morning or a morning off. And in terms of hours of sleep, I would sleep anywhere from about 10 to about 5:30 or 5 o'clock. So that gives me on average about 6 hours per day. And some days I may increase that to kind of compensate for days where I haven't been able to sleep as much. Now, I personally prefer to get maybe 30 minutes less of sleep to be able to kind of get a jump start my day, do a little bit of productive tasks before I head to work. But I know a lot of you guys may enjoy that extra 30 minutes or that hour, and all power to you. But that, guys, is basically my schedule as an intern, my first year of residency. It is busy, but again, it gives you still enough flexibility to focus on other elements of your life. So if you guys have more questions of what residency is like, I'm gonna go ahead and link down below a playlist on YouTube that I have basically of what residency is like, what my schedules are like, as well as different vlogs that I've recorded during residency. So definitely check those out. If you are listening to this on a podcast form, definitely go ahead and subscribe to the TMJ show. Leave a review to be considered for a weekly giveaway for a free ebook or a course. And also drop your comments down below on YouTube to be considered for future Q&A sessions that I do on the TMJ show. But thank you guys so much for listening or watching, and hopefully I've been a little help to you on your journey. I'll see you guys in the next one.